It's an article that has influenced tremor research over decades, more or less. Tremor has always been a little bit of a wallflower in the 70s and 80s of the last century. But I was so fascinated by tremor because it's the prototype of a rhythmic movement disorder. The situation in the mid-90s was that there was no overarching tremor classification. The literature contained only a few opinions. There were publications certainly on Parkinsonian tremor, but no overarching classification that contained really the broad spectrum of tremors. What we did was to hold an MDS conference in 1997. All the important people of the Movement Disorder Society were there. We discussed for 2.5 days all about tremor. The most important takeaway was really that each tremor had a name. It had a clear description. It has a distinct designation. They were not new, they existed before, but they were now in a framework that was covering all tremors. It was a unifying concept. People understood each other better. It was used for 20 years, even longer. Tremor is clearly one of the most common movement disorders, and the consensus statement and the subsequent research that has developed out of this has been really a motor to drive the understanding of this condition. Most of the papers that appear currently on the clinics of tremor, they quote these MDS consensus statements. There's only one society in the world that has an impact on the whole development of Parkinson's disease research and clinical practice and all other movement disorders. I think this is the mission of MDS, to produce consensus statements and definitions and whatever regarding the diseases that we take care of. MDS has always been the leading institution, the leading group to move this forward.